I am amending an order directing the administration of COVID-19 vaccine by vaccine providers across Pennsylvania. This amendment requires vaccine providers actively receiving first dose allocations of COVID-19 vaccine from the state to coordinate with local area agencies on aging and medical assistance managed care organizations to schedule appointments for adults eligible under Phase 1A. I want to acknowledge that in many locations, this work is already occurring. That's why we're here in York County today, because the providers in the counties have been an example of how this works and works very well. We continue to hear from seniors and those with certain medical conditions who are eligible to be vaccinated in Phase 1A that they are still struggling to find an appointment to get vaccinated. We know not everyone has access to the internet or the time or capability to navigate provider websites or make repeated calls to schedule an appointment. Right now, there is simply not enough vaccine to keep up with demand in Pennsylvania. That's why we are exercising every available option to assist those who are currently eligible, and that's what today's order does. It will encourage vaccine providers to work closely with the AAAs and the managed care organizations. These are groups of older people looking to get vaccinated, and we already have established relationships between these providers and these AAAs and these MCOs. Together, we can work quickly to get individuals off of waiting lists and into scheduled vaccination appointments. We know that having a date certain, that time certain to get vaccinated brings incredible peace of mind for folks that are currently on a waiting list. Now, I want to be clear that we do not have enough vaccine to immediately vaccinate all of those individuals who are eager to and waiting to be vaccinated. We continue to advocate to the federal government to increase our supply and to fine-tune our efforts so we can get people in Phase 1A vaccinated. Despite the fact that vaccine supplies are not keeping up with demand, to date, we know that more than 3 million Pennsylvanians have been vaccinated, and nearly half of those are seniors. In fact, the CDC ranks Pennsylvania in 15th place on the list of US states administering at least one dose of vaccine to individuals. According to the CDC's data, we have administered one dose of vaccine to 28% of the state's population. However, we also know that there are still hundreds of thousands of seniors who want to get vaccinated, and we are actively working on a solution to ensure that occurs. As our vaccine providers work to schedule individuals, we will work through another amount of initiatives in place. We know that our vaccines will increase, that our children will get back to school, that our parents will feel safe, and that the vaccine is our path to a new tomorrow. The COVID-19 vaccine is safe, it is effective, and we want each person who can receive it to do so as soon as possible. The vaccine is our best defense against COVID-19. As we are seeing a slight uptick in COVID-19 cases across the state, I want to remind everyone to continue to be vigilant. If you have symptoms consistent with COVID-19, we have testing resources available for you to get tested close to home. And we need people to continue to wear a mask, even if you are vaccinated, while out in public, because we want to protect those who have not yet received the vaccine. We need Pennsylvanians to continue to social distance when in public, and each of us must continue to wash our hands to take steps to protect one another. The desire of our seniors and those in Phase 1A to get vaccinated is a tremendous statement to the desire of Pennsylvanians to look to the future. We thank each individual for the efforts they are taking to protect themselves, their loved ones, and their community. Thank you. I'm now happy to introduce Secretary of the Department of Aging, Robert Torres.
Thank you, Secretary Beam. Good afternoon. I'm pleased to join my colleagues from the Departments of Health and Human Services, the Pennsylvania Association of Area Agencies on Aging, and York County leaders to talk about the collaborative work we are doing to help more older adults obtain their vaccine appointments. Pennsylvania's older adults face many challenges throughout this pandemic, and we are working together to reduce their frustration in getting appointments by building on existing partnerships between area agencies on aging and their local partners, such as the one that exists locally between York County AAA and WellSpan York Hospital. We're also supporting new partnerships with vaccine providers where needed. The AAAs have been supporting their communities and working very diligently to respond to the needs of older adults that represent some of the most vulnerable members of our communities. These agencies have coordinated with many local partners such as hospitals, pharmacies, community health centers, and emergency medical services to help meet the needs of older adults. They have also collaborated with the Department of Aging's PACE pharmaceutical program to help connect eligible older adults to vaccine appointments. A few examples of the support that they have provided include scheduling vaccine appointments, arranging transportation, offering senior centers to serve as vaccine clinics, providing information to older adults and their families, supporting vaccine clinics at senior housing complexes, and identifying and making vaccine arrangements for homebound seniors. In addition to work being done by the AAAs, our PACE pharmaceutical program, serving 275,000 older adults, has used its call center resources to make vaccine appointments for its enrollees, who are also some of the most vulnerable seniors we support. In coordination with PACE and Walmart, AAAs have been able to pre-enroll older adults in vaccine clinics in communities across Pennsylvania. In fact, one of the first clinics took place in York County with help from the York County AAA. Each of these Walmart clinics are vaccinating about 5,000 older adults a week. Now, through the Department of Health's amended order, AAAs will be empowered to offer more help, more direct help, because they will have the ability to work with a dedicated vaccine provider in order to secure appointments for older adults. It's important to understand that we are not starting from scratch. Some of these local partnerships between AAAs and vaccine providers have already existed and have had measurable success. Practices that have proven helpful include hospitals designating a set of vaccine appointments to help the AAAs move through their consumer lists and schedule appointments. Hospitals and other providers supporting vaccine clinics in senior housing complex with AAAs assisting in those efforts. Pharmacies setting aside specific timeframes in their schedules to allow AAAs to fill up those appointments. What we are doing now is introducing another option to improve the vaccine administration process by building upon and improving the successful models that have already made a difference in many communities. Getting all of our older adults vaccinated will take ongoing collaboration and information sharing among all of our partners. It would also take continued patience and cooperation among those we're attempting to serve. So if you're an older adult or a loved one assisting an older adult who is able to use the internet, please utilize the Your Turn tool on the Department of Health's website. If you aren't able to use online resources, your local area agency on aging may be able to help you. We all share the same goal to vaccinate as quickly as possible all older adults who want to be vaccinated. While much work remains to be done, we are hopeful that promoting more effective partnerships at the local level means more older adults will get the help they need to obtain a vaccine appointment. On behalf of the Pennsylvania Department of Aging, I want to thank all the area agencies on aging for all of their hard work, along with the many vaccine providers who have offered their partnership and support to get this job done. Your efforts are sincerely appreciated. Thank you. It is now my pleasure to introduce Dr. Doug Jacobs from the Department of Human Services.
Good afternoon, and thank you, Secretary Torres, for the introduction, and Acting Secretary Beam as well for allowing me to join you today. Again, my name is Dr. Doug Jacobs. I'm the Chief Innovation Officer of the Department of Human Services. The Department of Human Services administers Pennsylvania's Medicaid program, which helps more than 3 million Pennsylvanians access health care. Medicaid covers people in lower income communities, as well as some of Pennsylvania's seniors, and disproportionately covers communities of color, groups that we know have been particularly challenged by the pandemic. Targeting vaccines to Pennsylvania's seniors and people with pre-existing conditions is our best line of defense to protect people who are at highest risk of severe illness from COVID-19 and to help us continue to make progress in this fight. But we know some individuals may need extra help finding a vaccine provider or need assistance getting to their appointments. In our Medicaid system, managed care organizations, or MCOs, coordinate delivery of care and other supportive services for people covered by Medicaid. Our MCOs know the health risks and pre-existing conditions their members have. They know who's currently eligible and can connect them to gauge their interest in the vaccine, provide information to help them feel safe and empowered in making this decision for themselves, and connect them to a vaccine provider in their community. Navigators exist across our healthcare system to ease access to care for people who need it. And this collaboration is just another example of that. Beyond just helping them get an appointment with a vaccine provider, the MCOs can coordinate transportation to appointments and on-site assistance that is needed. Barriers that, without this direct intervention, may keep people who need these vaccines from being able to get one on their own. MCOs will also be able to stay in touch with their enrollees to ensure that they're getting their second dose of vaccine, when they get Moderna or the Pfizer vaccines in particular, keeping that direct line of communication that is necessary. We're working with both our physical health choices managed care organizations to reach adults who are eligible, and our community health choices managed care organizations to coordinate vaccine appointments for seniors who are covered through Medicare but use Medicaid for long-term services and supports, as well as adults who have a physical disability covered through Medicaid. This builds off of a partnership announced last week between our Community Health Choices MCOs and Rite Aid to vaccinate 9,000 of the most high-risk individuals covered through Community Health Choices and the Pennsylvania Life Program. So again, these are seniors and individuals with physical disabilities. Preliminary data for this partnership received from the MCOs registering participants shows that we're reaching a racially diverse group through this effort, a necessity as we strive towards equity both in our vaccine process as a whole and as we seek to ease vaccinations for our most vulnerable Pennsylvanians. And we know that COVID-19 has had a disparate impact on communities that experience poverty, where we know that also racial and ethnic communities are disproportionately represented compared to their overall representation in Pennsylvania. For example, Black Pennsylvanians represent about 12% of the population but make up about 25% of the Medicaid population. Hispanic Pennsylvanians represent about 7.5% of the population but make up about 14% of our Medicaid population. So as we seek to keep equity at the forefront of our vaccine rollout process, this direct line of outreach to Medicaid enrollees who are eligible to be vaccinated will help us continue to work towards that goal. We do not want to leave anyone behind in the vaccination process. Continuing to leverage MCOs and their relationships with individuals they coordinate care and services for will help us to continue to reach our most vulnerable, especially those who come from disadvantaged communities and circumstances who may have greater barriers to getting a vaccine appointment on their own. We've made incredible progress across our vaccine rollout, and Pennsylvania's work to partner with vaccine providers to target long-term care facilities and congregate care settings that serve vulnerable and medically fragile Pennsylvanians is keeping people safe and helping us gain crucial ground in the fight against this pandemic. Our continued partnerships with our managed care organizations and area agencies on aging will build on this effort and help us reach our goal of getting Pennsylvanians who are most at risk in this pandemic access to these vaccines and help save lives. Thank you again for allowing me to join you all today. I'd now like to introduce Rebecca May Cole, Executive Director of the Pennsylvania Association of the Area Agencies on Aging.
Thank you, Dr. Jacobs. Thank you, Acting Secretary Beam, Secretary Torres, and especially commissioners, the York County Commissioners, for inviting us here today to see your beautiful city. My name is Rebecca May Cole, and I have the privilege of working for the Area Agencies on Aging as the Executive Director of their association. Pennsylvania's 52 Area Agencies on Aging, or AAAs, have worked to provide assistance to older adults for more than 40 years. This past year has been the most challenging due to the COVID-19 pandemic. And unfortunately, our older neighbors, relatives, and friends have been hardest hit. The AAA network has done their best to ensure that critical services continue and that the most vulnerable seniors have support. AAAs have made thousands of wellness calls to isolated individuals, providing drive-through pickup meals and delivering meals to individuals' homes. They pivoted to remote assessments and protective services investigations, following guidance from the Department of Aging and working to protect their staff with personal protective equipment when circumstances necessitated an in-person contact. As we've learned more about the COVID-19 virus, AAAs have made needed changes quickly. Now that the vaccine is available, they have tirelessly worked to assist seniors by providing information and support to older adults. We appreciate the Department of Aging's leadership throughout this process, as well as the Department of Health and Acting Secretary Beam's new order requiring closer collaboration between the vaccine providers and AAAs. We appreciate the support for older adults, and we look forward to a better and more cooperative relationship in the future as we all do our best to ensure that older Pennsylvanians get the vaccines that they need. Thank you. And now I will introduce President Commissioner Julie Wheeler.
Thank you everyone for coming today. Today I'm joined by fellow Commissioners Smith and Hoke and Mark Shea, who is the Director for York County's Area Agency on Aging. As Secretary Torres said, our York County community has made great strides forward in combating this deadly virus. Collaboration has been at the core of that effort in York County. Collaboration between county government, the private sector, neighbors, and supporting neighbors. Today, the York County Community COVID-19 Vaccination Clinic is open. It opened at 11 a.m. today. And this is a collaboration between York County government and WellSpan Health to help our community in this great time of need. It's staffed by the COVID-19 Hope Squad, which includes clinical and non-clinical volunteers from our community right here to help vaccinate our friends and neighbors. The site is anticipated to administer nearly 6,000 doses of its first week and has the ability to scale up to meet the demands of our community. As Secretary Beam alluded to, the state's newest order calls on healthcare providers to coordinate with our local Area Agency on Aging to schedule appointments for older adults eligible under Phase 1. We very much appreciate the order from Secretary Beam, but here in York County, we've been collaborating with our Area Agency on Aging, and our priority continues to be vaccinating those individuals that fall within Phase 1A. The York County AAA, WellSpan Health, and UPMC have been working closely together for weeks, and that about 230 York County residents in Phase 1 have been scheduled for their vaccination through that partnership. More referrals are made every week. York County's AAA is aggregating older adult names and sending those names to WellSpan to schedule them for vaccines at our community vaccination site. We are also working with home-delivered meal consumers to identify those needing a vaccine and again, providing those names to our healthcare providers. I have to commend Mark Shea and his staff for leading these efforts. We're also working with our senior centers. who are assisting older adults in the community to identify vaccination needs, and they are then collaborating back with our Department of Area for Agency on Aging to get those names to our healthcare providers. We're working with WellSpan to see that older adults in the county have the opportunity to obtain a vaccine. We are also identifying consumers that are homebound or have other issues to see that they get prioritized. We're actively working with the Department of Aging to identify other seniors in the community that may be at high risk, and then contacting them to help them schedule to get a vaccine. Secretary Torres spoke about transportation. York County has collaborated with Rapid Transit to provide free ride share to those needing a vaccine. I would encourage you to visit www.vaccinateyorkpa.org. There you can find all kinds of information regarding plans in York County for vaccination. Here in York County, we have been and will continue to get through this together, and we will be stronger as a community.
Yes, ma'am, we have a little bit of time for questions. If you want to raise your hand, Seth, I saw yours first.
Seth, Capitol Channel 27. You want to? Okay, great. So it seems like there's this dichotomy where in the aggregate, as you said, there's not enough supply of vaccine for everybody in 1A who wants it. On the other hand, when we were over at the community vaccination site yesterday before it opened, WellSpan told us they have appointments Friday, Saturday, Sunday, Monday. Seems like we're going to hit this point soon where there's going to be slack capacity. And yeah, there are going to be people out there who, for whatever reason, are not going to be getting it. But there are appointments that are going unfilled. At what point do you move on to 1B, make it a two-pronged thing, keep doing everything that you're talking about, but also just try to vaccinate as many people as possible, because in the end that protects other people. Obviously, if I'm vaccinated, that helps people around me.
Yeah. Thank you so much. And so folks heard the question. It's really, the crux of it is, how do you know to transition to 1B when you know that there are certain community sites that have made great progress through 1A, and you want to be as efficient as possible moving forward. So we knew that it was not going to be a quick flip of a switch, right? We wanted to transition gradually, just as there's 66 counties with different experiences with the progress they've made through their communities in getting vaccinated. And so what we allowed the Janssen vaccine to do is come in and start in on the educators and the childcare workforce, which are part of 1B, being able to introduce that 1B crowd into the vaccination population while also staying dedicated to what is our phase 1A mission, which, again, as we mentioned in the remarks, we know that there are regions of the state that have a long way to go to get through that phase 1A mission. Incrementally, now we allowed there to be a next tranche of 1B workers that are going to actually be availing themselves of the vaccine. This is our grocery store workers, our food manufacturers, our law enforcement, and our firefighters. So what we're doing is we don't want to put pressure on the system like what happened when we had those over 65 and the 64 and under with comorbidities come in and put so much stress that really it was just standing in line for an appointment. And we're incrementally allowing these populations of frontline workers to get vaccinated that hopefully we'll be able as a Commonwealth to transition into 1B quite swiftly as we have these populations handled in an orderly fashion. Yeah.
Hi, I have a question that has a little bit of a follow-up to it too.
Yeah.
You noted in your order that there would be enforcement actions taken against vaccine providers who did not follow this. What kind of enforcement are you talking about? What kind of strike system is there? And also as a follow-up to that, what about these providers who already have waiting lists that are 2 months old? Are they supposed to deny people that are already on the list to move up phase 1A? I mean, is that creating an unfair system too?
Sure. So enforcement first and then 1A second. So enforcement-wise, we have actually, the greatest leverage we have right now is the power of the vaccine. We have over 2,600 providers who have enrolled that want to be vaccinators. We've narrowed it to a group of about 220 providers who are right now really responsible for delivering that vaccine mission in the Commonwealth. What we've allowed ourselves to do is very closely follow any compliance with the order, and where there is non-compliance, our greatest tool is leveraging the vaccine and pulling back vaccine from those providers. So where we've leveraged it to date is where providers haven't reported data as quickly or as holistically as they're responsible to do, which is really around race and ethnicity data, and allowing them to be able to, I think, understand that our greatest enforcement aspect is then not having them really be a provider in the vaccine network. And the second question on 1A?
Yeah, I was just wondering if some pharmacies already have waiting lists and
Waiting
people
lists,
have been
yep.
waiting for a while. Are they supposed to let these other folks go before those lists? Or are they going to get in trouble if they say, hey, we have a waiting list already, we can't take you?
So no, they should be progressing through their waiting list. What we're working on right now is actually scheduling the appointment. So it's not waiting list to waiting list, it's waiting list to a scheduled appointment. So it should say April 10th at 10:15. And that's the peace of mind that folks are looking for right now. They don't want to know that they're number 1,000. They want to know when their first shot is going to get into their arms. And that's really the whole impetus for the order.
Hi, Secretary Dean. Thanks for your time. I wanted to know if you could address the Janssen & Janssen situation where the state may not be getting what it expected next week. Can you talk about what you are going to get now and how far short it is and how that's going to impact the teachers and those in 1B and the future regional clinics?
Sure, absolutely. So as with all things in COVID response, this is requiring us to be quite nimble as we learn our weekly allocations. And so initially we had indications that there was going to be close to 200,000 Janssen shots coming the end of March. That shifted, and actually because of both manufacturing and then also investing in retail pharmacy partners from the federal government, it's now closer to that 65,000 amount for this upcoming week. What we were able to do is continue on both missions. And so because they shifted part of it to the retail pharmacy partners, we're going to be working closely with them so that they actually are able to be the open doors for that 1B frontline worker population. We still have sustained enough of the Janssen vaccination to allow those regional clinics that had already been really indicated in our first announcement to be operational and up and running on that first tranche. What we've been told is that should be a sustained level or growing, and so moving forward, that's our visibility into the allocation week over week.
I agree with PEMA, who indicated that it would be impacted, the groups, in administering vaccine, that shortage will have an impact on operations and plans.
So we have really pivoted to be able to sustain both missions while also fulfilling the 1A mission. And so hopefully, again, as we have during this entire response, we'll continue to advocate for more. Trust. We will continue to advocate for more vaccine, but I think it's our responsibility to fulfill our missions based on what we actually end up receiving. Yeah.
Secretary, I think a little bit of a follow-up to Seth's question. I think a lot of people that aren't in phase 1A they want that date. They want an expectation of when can I get my shot? Is there any talks about when we'll move to phase 1B?
Yeah, sure. So incrementally, we've had those frontline workers actually be able to progress. The president did not dodge the May 1st deadline, right? And we are going to comply with a May 1st deadline that opens up the vaccination process to the entire Commonwealth. In that, our responsibility during this month of April is to get through as many folks as we can, including the 1B population. So hopefully what we're able to do is allow these incremental frontline populations to be vaccinated off the Janssen vaccine, and then allow the month of April to really have the entire transition to phase 1B. Scheduling the 1A population is about also fulfilling our 1A mission, and that's what today's order is about. So we can really say those that are in 1A know they're going to have a scheduled appointment, and then the Commonwealth can progress to 1B without having anyone clog up the lines and the appointments.
Knowing that every county is different, every geographic area is different, is there flexibility now for those that are seeing from possibly 1B and beyond, just to make sure that the vaccine's not going to waste?
Correct. The entire underlying premises of our rollout has been do not waste vaccine. And we have been able to have close contact with our provider community to understand where they are reaching that point of being able to have appointments that aren't necessarily being filled. What we're doing is making sure that where there's regions where a provider is saying, I actually have appointments that aren't yet filled, and yet we're simultaneously hearing that there's still folks that are interested in the vaccine, we're making sure that they work through either the AAAs, MCOs, or other entities to have there really be that culmination of the scheduled appointment for individuals. And then I think what we'll be doing is progressing to 1B quickly enough that there really will not be that lull.
Great. I wanted to switch gears a little bit. Today, Pennsylvania hit that 1 million mark for cases. And so I was hoping that you could comment on that, but I wanted to know if, by what you're seeing, is that the variant is popping up more in the state? Is it people aren't taking restrictions seriously? And could that possibly affect Governor Wolf making the announcement that restrictions were going to be eased next Sunday?
Yeah.
Since this is the biggest increase we've seen since February in a single day.
So I really appreciate you raising this. We work very closely with the governor's office every day to understand not just what our case counts are and our deaths and our hospitalization, but really the presence of those variants. And one of the struggles with the variants is having enough surveillance to know really how significant the magnitude of those presence is. At this stage, we have 199 variant cases that have been confirmed in Pennsylvania, one of which is the South African variant. And so the way that we have worked, I guess, is every day looking at where our case counts stand, where our hospitalizations and deaths stands, and that is all going to inform whether or not there's any deterring of the mitigation efforts being relaxed, but it's a consistent evaluation, and I think the governor has been very straightforward in that. He wanted to propose it to allow folks the time to plan, which they have asked for, but we're consistently evaluating what's best for public health. In fact, the CDC ranks Pennsylvania in 15th place on the list of U.S. states administering at least have administered one dose of vaccine to 28% of the state's population. However, we also know that there are still hundreds of thousands
of our communities. These agencies have coordinated with many local partners such as hospitals, pharmacies, community health centers,